About health reform, big topic right now. President Trump tweeting this about Senator Rand Paul this morning, someone who's been against the so-called Cassidy bill. He says, look, quote, Rand Paul is a friend of mine, but he's such a negative force when it comes to fixing health care. Graham-Cassidy bill is great. Ends O-care! Exclamation point. That is from the president this morning, calling out Rand Paul. All rise, Judge Andrew Napolitano. He's here. Judge,
all right, read what's in the prompter. That's what I'm laughing at.
No,
he's a no. He's always
a no. He's always a no. It's no.
So I strongly stand in Senator Rand Paul's camp, and here's why. Obamacare has four basic principles. One,
right.
The federal government has the obligation to provide health care coverage for every American. Can't say where that obligation comes from. Two, the federal government can mandate the acquisition of health care. Three, the federal government can micromanage health care. Four, the federal government can have access to the laptop of every primary care physician in the country and access to your medical records. Graham-Cassidy changes none of those principles.
Well, Rand Paul did say, look, we're throwing out Obamacare and replacing it with Obamacare.
Rand Paul says we're not throwing out Obamacare. We are making it permanent, but just giving it a different name. The four principles of federal dominance and federal intrusion and federal commands to individuals remain.
So what is the answer? Everyone for themselves?
Well, the answer is the free market. Or the answer is regulation by the states. Or the answer is allow me in New Jersey to buy an insurance policy from Colorado rather than forcing me as an unmarried man to have maternity coverage. I don't think I'm going to be using that, or I don't think I'm going to need it.
Well, if you do, we'll have you on the show.
Right, but right. I'd be the eighth one in the world. But I have to pay for it under Obamacare and under Graham-Cassidy.
But it's an all-or-nothing situation. What you're saying is we'll say no to everything that doesn't match 100% what we want.
Well,
surely some compromise is the only way anything's ever going to get done.
The insidious victory that Barack Obama as president achieved was persuading Republicans that it is the duty of the federal government to assure health coverage for everybody else. Because 5 years ago, Republicans condemned that. They condemned it in their campaigns, they condemned it in their party platform, and they condemned it on the floor of the Congress. True. Now they go along with it.
Yeah, but it gets away with the individual mandates.
It doesn't get away with the individual mandate. You still have the obligation to have insurance, and if you don't have insurance, when you do get it, you are forced to pay for the years that you didn't have it.
But it gives states a lot more leeway than before.
It gives the states leeway with federal dollars, which will eventually be accompanied by strings that the states will have to comply with.
I come back to the same point. The only way you're going to say, yes, that's a great plan, is if we just scrap the whole thing and throw it up in the air and let the free market dictate.
The feds should have nothing to do with health care. That's not me. That's the Constitution. Where is Stewart when I have to argue the Constitution?